Hello doctor and medical students, I am Dr. Amit. So today we'll move forward in beta-lactam class of drug, and today we'll talk about cephalosporin. So as we all know that cephalosporins are a group of antibiotics belonging to beta-lactam class of drug. While talking about the mechanism of action of cephalosporin, so it is same as penicillin. The cephalosporin bind to penicillin binding protein, also called as transpeptidase, and doesn't lead bacterial cell wall synthesis and finally lead to bacteria death. While compared to penicillin, cephalosporins are generally more resistant to penicillinase enzyme. As we all know that penicillinase is a type of beta-lactamase which is produced by some bacteria, which clips a beta-lactam ring present in beta-lactam groups of drug and finally inactivate the drug. Now talking about the generation of cephalosporin, so totally there are 5 generations: first, second, third, fourth and fifth generations. Okay, and with each increasing generations, the cephalosporin groups of drug increases the gram negative coverage. Now while talking about some bacteria which is not covered by cephalosporin, it is remembered as LAME. One is Listeria, one is atypical organism like chlamydia and mycoplasma, then MRSA and enterococci. Now let's talk each generation one by one. So while talking about first generation cephalosporin, it includes a drug cefazolin and cephalexin. Now these drugs mainly work against gram-positive cocci like Staphylococcus, Streptococcus, along with Proteus mirabilis, E. coli, and Klebsiella pneumoniae. You can remember as a mnemonics called PECK. Okay. Now while talking about its clinical use, it is mainly used for skin and soft tissue infections and surgical prophylaxis. So we mainly give cefazolin is used before surgery to prevent staphylococcus infections, and cephalexin is commonly used for uncomplicated skin infections and UTI. Now let's talk about second generation cephalosporin. So it includes a drug cefuroxime, cefoxitin, cefotitin and cefaclor. So comparing to first generation, it has slightly increased gram negative coverage. So they cover gram positive cocci, Haemophilus influenza, Enterobacter aerogenes, then Neisseria species, then Proteus mirabilis, E. coli, Klebsiella pneumoniae, and one is Serratia marascens. Now let's talk about some important point regarding these drugs. So the drug cefoxitin and cefotitin also work against anaerobes like Bacteroides fragilis. Now talking about its clinical use, it is mainly used against respiratory tract infections, then sinus infections, then otitis media, and after then intra-abdominal and pelvic infection. Now in next video we'll talk about third generation and fourth generation cephalosporin and its adverse effect and resistance. Thank you for watching.